I'll never forget the day that my 4-year-old son Logan almost died in my arms in Royal University Hospital. We were sitting on his hospital bed when he let out a scream. And I knew that he shouldn't be screaming because he shouldn't have been in any pain.
A bag of potassium that was a concentrated, heavy concentration bag was hung instead of a diluted bag.
As a pharmacist, I know that when the concentration of potassium is too high, that it can burn. So I knew when I looked behind me and saw potassium hanging that the concentration Logan had been given was too high for him, and as a result could have killed him. I immediately locked his IV and I started to cry and shake with all the chaos going on around us.
I went over to the bedside and saw that she clearly was upset about something.
And he looked right at me and he said, "I have no idea what you're talking about, but I trust you and I know that you know there's something wrong. I'm here to help. Let's figure this out."
We rolled Logan down to the OR waiting room where we met up with the anesthetist. And come to find out, he didn't even know that Logan had a kidney condition. He wouldn't have required us to increase the potassium if he had known that in advance.
I firmly believe that everybody that day was working with my son's best intentions. I work in the system myself, and I saw errors. I've been involved in errors before, but the way Saskatoon Health Region handled this error has been incredible to watch. Their openness to understand that there are safety defects in the system and their openness to work with me and to try to fix them have been unlike anything I've experienced in my own healthcare career to this point.
The most important thing that I learned from this whole experience was that, first of all, we as healthcare providers need to talk to each other. We need to be able to listen to the families. If we are in a situation where we're not sure what's going on and we're not comfortable with the situation, we can't be scared to just push the stop button and figure out together what's really gone wrong.
Safer Every Day is a 90-day initiative where we are focused on improving safety for patients and our staff. One of the areas of focus is on team communication. We're really working on how to help teams communicate, including the patient and family, in a way that keeps everyone safe. The other area we're really focused on is how do we support both the patient family, the staff, and the physicians who are involved in events like Logan's, so that they feel supported after the event, that we all learn from the event, and that we work together to put in initiatives or improvements that make our care safer every day.
I was devastated when I heard Logan's story, but I also know that unless we figure out how to work differently and build safer systems, that what happened to Logan could happen again.